Mental health has always been a subject of exploration, description, and discussion throughout history. More often than not, mental health has been understood as a series of abnormalities, addressed primarily through medical and therapeutic interventions. Initially, these causes were attributed to individual internal changes in biochemistry, which created significant stigma around mental health difficulties. Over time, and particularly due to large-scale events such as wars and natural disasters that caused displacement, people began to recognize that many external factors contribute to psychological distress and subsequent mental health difficulties. Evidence shows that social determinants such as conflict, social exclusion, housing conditions, pollution, climate-related factors, cultural practices, policies and regulations, access to services, and adverse childhood experiences often have a significant impact on our well-being. As our understanding evolved, mental health support was initially recognized as a critical component of emergency responses to disasters or crises. Later, it was deemed essential in all aspects of prevention, promotion, and recovery. Today, mental health and psychosocial support, MHPSS, acknowledges that the psychological and social aspects of the human experience are deeply interconnected. As a result, MHPSS encompasses a broad range of interventions aimed at promoting, protecting, and restoring the overall well-being of individuals, families, and communities through unique approaches, tools, and guiding principles. Currently, there is a global shift towards integrating MHPSS into all development programming. Although developmental programs have yet to systematically incorporate MHPSS tools and approaches, integration can enable programs to understand participants from a well-being-oriented perspective. This understanding allows programs to design interventions that help individuals cope with stress, build resilience, develop new skills, and contribute to their communities, thereby enhancing the original program objectives. MHPSS integration can occur at all stages across various types of development programming. Here are some examples of how MHPSS tools, resources, and activities can be embedded into different stages of development programming. Supporting individuals in fulfilling their essential needs in a socially appropriate manner is a core component of improving well-being. These needs could include access to food, sanitation, shelter, safety, reparations, healthcare, education, opportunities, and other unique requirements specific to different individuals or groups. This process may involve conducting participatory, qualitative needs assessments to understand the psychosocial burden of issues on participants before designing program interventions or at the start of the project cycle. Some communities may consider grieving and healing as essential needs, which could involve support for family reunification, memorials, cultural healing rituals, platforms for sharing and making meaning of experiences, community support groups, and mental health interventions. Advocating for state service providers to communicate in local languages and address the needs of individuals with disabilities or alternative communication preferences is also crucial. Integrating MHPSS perspectives fosters a stronger sense of belonging, creates opportunities for collective healing, and reactivates social networks, all of which play a significant role in building sustainable development initiatives. This could involve participatory mapping tools to assess social networks, social exclusion, and isolation within families and communities. Development activities can aim to restore individuals' confidence in their capacity to recover, rebuild, and thrive. Equipping individuals with skills in supportive communication, problem management, conflict resolution, or parenting while creating self-help groups integrates psychosocial considerations into program activities. A smaller number of individuals in each community may require focused, non-specialized support. Assessing key mental health, well-being, and psychosocial issues enables the provision of targeted support for those in need, positively influencing project outcomes. For instance, community members may face barriers to participation, such as gender norms or societal attitudes, which require tailored interventions. Training service providers and community members to reduce re-exposure to traumatic events is essential. For example, educating judges and lawyers on the psychosocial impact of family violence and separation on children can promote sensitive and informed service delivery. Recognizing and revising interventions to address the diverse experiences and needs of participants also enhances program effectiveness. Tools such as psychological first aid and basic psychosocial skills can be utilized to sensitize civil society organizations and other service providers. A small subset of individuals may require specialized services such as clinical psychotherapy, medication, rehabilitation, treatment centers, or safe homes. Programs integrating MHPSS can focus on improving the quality and access to these services. This includes creating databases on pathways to MHPSS services and training community members to support individuals in accessing these services without stigma. It may also involve designing safe homes for elderly care, survivors of gender-based violence, children in conflict with the law, and individuals marginalized due to sexual orientation or gender identity, ensuring a client-friendly, person-centered approach. Additionally, MHPSS sensitive designs for spaces such as police desks and local government offices can create safe, private, and confidential environments for individuals to discuss emotionally distressing or traumatic incidents. MHPSS is not a standalone solution, but an integral component of a broader developmental approach across all phases of programming, including planning, implementation, monitoring, and evaluation. This approach helps design sustainable interventions that respond to immediate needs while supporting long-term well-being and community cohesion. Ultimately, this ensures the creation of a future where every individual receives the support needed to thrive and contribute to their community.